What if I told you the reason you are confused by NCLEX question is not because you are not smart enough, but because you are thinking like a student, not like a nurse? Now, here's the real question. Can you unlearn the way you have been trained to think before it's too late? If your answer is yes, congratulations. I'm going to show you something, right? I will show you this using a practice question. NCLEX pass question. I don't like doing question bank, right? I don't discourage question bank, but I prefer to use NCLEX pass question, because that way I can explain similar things you are going to see on the exam. Unlike most question bank, most things you are going to see are not related to the writing style, right? The testing style, the only thing they focus on is content. And most of the time, they don't test the content related to the content source of the NCLEX exam. They test content related to what they feel, what they have seen, and also what is related to nursing school. Now, nursing school test you related to knowledge-based question, right? You are not about to learn knowledge-based questions. You are about to learn what? Practice-based question, because NCLEX is all about practice-based questions, not knowledge-based question. On the NCLEX exam, in nursing school, NS, nursing school, all you just have to figure out is what? The question. But on the NCLEX exam, you have to figure out a lot of things. You need to figure out what is going on, what is the examiner testing me, and what the answer keys as well too, right? You need to figure out the answers. So you need to figure out what is going on, what is the examiner testing me, and you need to figure out each answer keys, because the answer keys are mini question on its own. NCLEX is wonderful. One, you need to spot what the NCLEX is testing. You are going to get that from the body of the question. Now you need to understand what the examiner is testing you on. Like, it's going to ask you. That is the STEM. And then you need to figure out what each answer keys are also testing, because your answer keys are written in form of also a mini thinking or a mini question as well too. Right. I'm going to show you that real quick. But let me tell you something so that you understand. I've been coaching for the past 2 years, right? And so far, so good. I've been seeing this. The main reason why a lot of students get stuck between two answers is because they don't have a clear pathway to selecting the correct answer. What if I can show you that there's a unique way, something you should know, but you avoided in the initial point of studying? Now, let me tell you what you avoided in the initial point of studying. Every student should study in a way that it is clear, direct, right, and give you what you want. If you are studying and you're if you are studying, right, and you notice that you are coming across difficulty, then there's a problem with that study plan. You need to fix it. Now, in order to pass the NCLEX exam, you need to have what? These three phases. This is what I walk my student through, right? Last week I got a lot of messages from students who want me to help them pass the NCLEX exam, which is amazing because I love doing that. Now, I walk them through these three phases, right? Phase one is to understand the NCLEX. Phase two is to plan. Phase three is to study. Now, the problem is this: a lot of students don't understand the NCLEX, they don't plan, they just want to study. Now, when a student finish nursing school, what do you think they always think of? I asked a particular student, when you were done with nursing school, what did you do next when you noticed that you're about taking the NCLEX exam? She said she got to a question bank to study. Right. Did you finish the question bank? Yes. Did you pass the NCLEX exam? No. How many attempts? 3 attempts. Now, how many question bank have you used in that period? She have used 2 question bank. How many questions each? 2,000 multiplied by 2, 4,000 questions. All right. Did you study content for the exam? Do you know your content? Yes. Mention one of the content NCLEX is about. NCLEX that you know NCLEX will test you. I don't really remember. Now, this is somebody that want to what? Pass the NCLEX exam. Now, you cannot remember one content from every content that NCLEX wants to test you. Are you really ready to become a nurse? Right. Now, the problem is this: a lot of people are just looking for questions that will be similar to that on their exam, in order to pass. Now, nursing school question is different from NCLEX question. Nursing school question is related to knowledge base, right? NCLEX question is related to practice. This is the idea of the NCLEX, if you don't know. Nursing school give you the knowledge you need in order to attempt the NCLEX exam that is going to provide you the license. So in nursing school, NCLEX is testing you related to knowledge. That is the reason why each semester you know about your courses. But NCLEX don't care about your courses. NCLEX care about the practice area. NCLEX is testing you to practice, right? So they care about the practice area. When nursing school care about you passing your courses, NCLEX care about you performing care related to each practice area. Now, we have 8 practice area, which is known as what? The 8 client needs. A lot of students, I bet a lot of students don't know this. I've been coaching for the past 2 years, and so far so good. If you ask them what are the 8 client needs, they don't know it until they fail. It's when they fail, they say, is it what I saw on my test report? Because I was seeing something like I had below in management of care, this, that. Okay, now we are talking. Now you are understanding my language. So you had to fail to understand little about the NCLEX. Now, why do you think NCLEX is giving you the report? It's not for it's not a way of the NCLEX telling you you failed. No, there's a way of the NCLEX directing you. Now, if you notice something in your test report, right? Some people have 1-page document, some people have 2-page document. Now, but there's one thing you are going to notice in every test report. You are going to notice that after you see those categories, which are your 8 client needs, right? Above it, you are going to see list of websites telling you how to understand all this area and how to fix all this area. But a lot of people just say, oh, I failed. They squeeze the paper, they throw it away. Most of them just look at it and just say, okay, this is what I need to pass, and they call it a day. Now, it's more than that paper. One is that you want to understand this. Let me show you something. I'm about to answer a particular question because I want to show you why a lot of students feel every answers on the NCLEX exam look correct. I want to review that because it's a big problem. A lot of students complained that last week was I was attending to a lot of students. Right, last week. Who messaged me directly from YouTube. By the way, let me just say this real quick. Uh, a lot of you have been asking me, how can you reach out to me to help you pass the NCLEX exam in 85 questions? Because this is what I do for my students, helping students pass the NCLEX exam in 85 questions, right? So the easiest and fastest way to get in touch with me is to text me, right? I want you to text me at +1 767 613 0769. So text me +1 767 613 0769. Right. So I want you to listen to me. Right. I started this complaint to help you pass the NCLEX with the minimum number of questions without struggling. So if that is what you want, if you feel you struggled, I've seen a lot of students, they want to give up, right? But if that is not you, if you are that kind of person that you are still looking for a way to pass the NCLEX exam and you're not about to give up, text me right now. So let's get back to the training video. Now, I want to train your mindset in the way you think like a nurse so that you understand the NCLEX, right? Now, this is the mindset of the NCLEX, right? The NCLEX examiner, right? They understand something about you. They understand you are done with nursing school and you have audio nursing school knowledge. But at this point, there is confusion because you don't know what to study. Now, if in nursing school you are about to do a particular exam, right? What would your examiner do? Your examiner is going to give you what? Let us say this your lecturer, right? It's your lecturer for what? Med-surg. Right, you're about to take this exam. Now, we know we are taking med-surg exam, but the confusion we have right here is that there's a lot of things we study in med-surg. What if our lecturer cannot tell us, okay, I want you to focus on hypertension, I want you to focus on COPD, and I want you to focus on MI. Now, at this point, if our anxiety level was what? 90%, the lecturer, by telling us this, the lecturer has reduced this by let me say half, 45%. So now this is our level of anxiety. And the reason why we are still having this anxiety, can you guess it? We're having this anxiety because now, though we know the focus area, but we don't know the questions that is going to what come out related to each of these focus area. Now, if there's a way, there's a particular student that told me this, right? She, I helped her to pass her LPN exam. This is what I do. I don't only help NCLEX students, I also help students in nursing school. So when she was in nursing school, right, I helped her to pass most of her courses, right, before she attempted the exam. So I both helped her in nursing school and I helped her for the LPN, right. So it's a different thing entirely. Nursing school package, NCLEX package. I run both packages, right. So she passed the LPN, right. She also wanted my help for RN. We were discussing about this seriously. But later on, she now said, "Oh, I don't feel like she stressed you for the RN because somebody just told me right now that the school that I want to attend, right, I can easily practice the past questions and I will get the same thing on the exam and pass. But she will see to that. But if she need my help, she will let me know." Now, she started RN, right? And then truly she got past question and she was what? Able to pass each exam. Right? Now, let me tell you something that you don't know. Past question can help you pass exam, but it can never give you what? Past question can never give you the ability to think because there's no thinking process. What you are thinking at that point, what you are doing at that point is to know the answers. You are knowing the answers without no reason. You just know the answer just because you want to just pass. Now it's going to be a problem because the time we are going to take the RN exam, right? It will be a very big problem. A lot of students fall in this category. I've seen a lot of students say, "Oh, when I was in nursing school, I only just use past question," right? And this is one reason why a lot of students fail the NCLEX exam. Now, guess what? This particular student, after knowing that she have med-surg exam, knowing the focus area, now having a past question, then this anxiety level will reduce, right, to at least 5%. Now, this 5% is like the fear of the unknown, mm, that is telling her maybe the question might change on the day of the exam. Maybe the examiner will decide not to bring same question that they have been testing previously before. That is just that 5% fear she had. Right. And that's it. Now, during some set, most time I always used to send questions and I'll be like, "Oh, answer this question, at least get prepared from now to when you are ready for the NCLEX exam." And she, like, I gave her a particular question one day. I asked her, "How many questions can you answer each day?" She said 25. I sent 25 questions to her, right? She out of the 25 questions that I sent to her, she only got 7 correct over 25. She said, "Oh, it's because she was answering it when she was at work. That's the main reason why." That I should send another one. This time around, I should send the 25 again, another 25 again. I said, "Okay, if you're at work, you might not be able to pay attention to 25 questions. Let me send you 5 questions." She said 5 is too small. I should send that 10. All right, I sent 10. Now, from this 10 question, she only scored 3 over 10. You see, big problem right now. She said, "Oh, am I that bad?" I said, "All right, let me give you 5 questions. This time around, take your time because I want to understand whether there's a problem. Take your time and answer it. When do you feel is best for you?" She said, "Okay, when she finish work. She work double shift, right? I guess that's 18 hours, right? So after she said she's home now, I can send the question. I say, okay, take 2 hours rest so that you rest and then you are able to do this question because I want to evaluate something, right?" Now, when she rested, right, and she woke up, said, "Okay, she's ready now." I sent the 5 questions. Do you believe that this lady had none of those questions correct? 0 over 5. Now, you can see the problem. And I told her, past question cannot help you. You don't have the thinking process. She said, but she was thinking maybe when she's ready for the NCLEX exam, it will be like at least the biggest part is for her to finish nursing school, and when she's ready for the NCLEX exam, everything will come in place. I said it's never going to come in place, because you are still going to restart that same process that you bypass again before you take the NCLEX exam. Remember, you need thousands of nursing school knowledge in order to pass 146 worth of RN content knowledge, or 150 worth of LPN content knowledge. Because now, as I'm saying, you can see the process of nursing school, right? Same process applied to the NCLEX as well too. The NCLEX, right, want to test you related to what? Exam, right? Related to your practice. Now, same with nursing school, you have what? The NCLEX exam. Now, you have the NCLEX exam, but now your fear right now, that is 99%, is that you don't know what will be tested on the exam. That is the main reason why NCLEX provided the content. Now, the content, you are going to get the document from what? The NCLEX test plan. NCLEX test plan. Now, this NCLEX test plan contains the content for RN. It also contains the content for what? PN. Now, RN have 146 content, PN have 150 content. So out of the 1,000 plus worth of nursing knowledge, NCLEX is just testing you related to this. Now, guess what? Every of this content built from this. Now, that particular student that have difficulty with answering those questions I'm sending to her, right? She will have to go through this same process again. Right. She will have to what? Go through this same process again. All right. So Now, this is just what? The content. Now, at this point, NCLEX has reduced your anxiety level to, let us say, that same 45% again, right? Now, the missing thing right now is that, okay, we know the content, but there's always two things a lot of students complain. I've been coaching for 2 years, so I'm trying to like pick the complaint, and most of the time it's the same thing. Now, if you ask students, do you know about the test plan? Some people will say, oh, I heard about it in nursing school. Oh, someone introduced it to me. Some people will say they don't know it. So it's like a 50-50. 50% of students will say they know about it. 50% of students will say they don't know about it. But either ways, right? It's only 90% of students don't care about this. Only 10% care. And the 10% that care drop out from using this, because at the end of the day, a lot of students are used to what? Spoon feeding. If they are not seeing many people talking about this, they end up feeling it's not important. That is one. Two, if they are not seeing anybody to give them information about this, they don't feel the need to get information by themselves. Now, there's a particular student that asked me, what is the meaning of what? Pulmonary embolism. Now, out of every question you can ask me, right? I feel like there are some certain questions that you can just go on what? Google. Sometimes I feel like Google don't even exist again in the world of most students. I feel like there's some certain questions you can just go on Google and just get the answer. But if you have confusion of that understanding, then you can now ask me, say, okay, I researched about pulmonary embolism. I had or maybe on Google or anywhere you want to like check it from. Right. And then you now be like, I noticed they said something about this. Well, I'm still trying to understand what they mean by this. If you can give me more what clarification, it make more sense to me than you just throw it on me and you just say, okay, can you tell me the normal vital sign for this? Can you tell me the normal range for this? All this information are right where you can easily get it. You don't need to message me. It only tell me one thing about you. You are not taking what? Charge of your studying. You relate, how do I say? Yes, it's this. You are not taking charge of your studying, right? You are just studying with no purpose. Because that is the main reason why some people use question bank. They don't even get full understanding, and they just leave it like that. I'm telling you the truth. Now, I've been coaching for 2 years. I've communicated with over 700 plus students, and I know what I'm saying because I see this a lot. Right. Now, the student can easily Google this, and I'll say, okay, what do you know about pulmonary embolism? Say, I know this person did not even take time to even look for the information themselves. They expect me to tell them the information. You can easily get what? First-hand knowledge about what you want to ask somebody. When you meet with confusion, that is when you now ask question. Am I making sense? Because at the end of the day, how do you undo the NCLEX exam when you cannot even undo this kind of situation? It's become a problem. A lot of people don't even know the small problem they have is what caused the bigger problem. And then you will see them saying, I'm about to give up. I feel like nursing school is not for me. I don't know why I keep getting questioned wrong, because you don't pay attention to building up your self knowledge. You pay attention to people giving you knowledge. You yourself need to build up something, right, that people will either tell you it's correct or people will correct you for. Am I making sense? That is how I learn. Right. Now, the next part right here is that people are looking for question, right? That is when you now what? Look into what? The NCLEX what? Past question. Now that way, you will now understand how the NCLEX write the question and test each content, because you will start noticing that each content that is on the past question, you will start noticing it from the content NCLEX provided that will be tested on the exam. So you would have seen a particular content and see how the NCLEX is testing it. You will see a particular content and see how the NCLEX is testing. That way, you now start understanding how the NCLEX work. So when you start even using question bank, everything start making sense to you, right? But the thing is this, let me be honest with you, the whole process is overwhelming. I'm saying it right here, it's very pretty on paper, but trust me, the process is overwhelming, and that is the reason why I'm ready to guide you through the process, so that it don't look like you are doing it alone. Sometimes it's just like, now, if you are sick, you need a doctor. Okay, let's say it this way. Now, when you wanted to become a nurse, right, you don't automatically become a nurse. You needed what? Nursing school program. So in life, sometimes when we want to do something, we need somebody, right? Not that we cannot do it on our own, but the process might be stressful, but we just need a easy landing, so that we just call it a day, right? There's nothing bad in getting somebody to help you out, right? In figuring things out and you're able to pass successfully. The whole goal is that you pass, right? Because I will help you out, but I'm not helping you to take the exam. So at the end of the day, you take the exam, you are the one that passed the exam, right? So now, this is it, right? You need to understand the NCLEX before you create a plan, because if you don't understand something, you cannot create a plan. It's just like a soldier that is going to war, right? If they don't understand their opponent, they will not be able to what? Create a plan. It's just like right now, okay, we want to go, let us just say we want to go in a particular journey, right? We want to go in a particular journey. Maybe I stay in Naples, and maybe I want to visit, um, let's say I want to visit Miami, right? Now, I want to visit Miami. I've not been here before, but I want to like visit. Now, I don't know how to get here. What I need is, one, I need to have an understanding that this is where I want to visit. Same way, you need to have a clear understanding that you want to what? Pass the NCLEX exam. Now you have this, but now how do you pass? That is the next question. How do I get here? That is the next question. Right. I know I'm coming here. I know I want to pass, but now I need a clear direction. Right? You need a clear pathway. That is how you think. You need a clear direction, you need a clear pathway. Now I can decide, okay, this is where I want to visit. Let me just get what? The location via what? Google Map. Right? Now the clear pathway to passing the NCLEX exam is what? Your NCLEX test plan. From this NCLEX test plan, you will be able to do two things, because now I walk student through three phases, right? Which phase one is three phases to passing the NCLEX exam. Phase one is knowing about the NCLEX. Phase two is to plan, and phase three is to study. A lot of students don't know about the NCLEX, they don't plan, they just jump straight to this. And when a lot of students finish nursing school, the next question they're asking themselves is, what question bank should they get? Now it's just question, nothing more, right? Okay. Now, so this is it. You need a plan. The plan is going to tell you about the NCLEX. The NCLEX test plan is going to make you create plan from there, because obviously you cannot create plan. Like now, if you now understand the parts, right? Then from there I will now know, oh, it's a long distance. Oh, it will take me this particular period of time, I need to get a taxi. I need to, those are what now plan, because I've created the understanding, right, about my journey. Now I'm able to plan related to what that journey, right, and then I'm able to get to what my location. You understand? So that is how the NCLEX work as well too. Now, but the truth is now, all these things you will be doing it yourself. But if you join my coaching program, you don't have to do these things yourself, because I figure everything out for you. All you just need to do is just follow the process. Right, finish it through. It's an 8-week coaching program. All you just need to do is follow the process, and you are definitely going to pass. The understanding, the plan. I've done the plan for you. You don't need to plan anything. Right, I've done the plan for you. That's the reason why when you join my coaching program, it's not you are not going to feel overwhelmed. All you just need to do is study and pass for me. That is just what I want from you. Right, I will create the understanding from you for you. Right, I'll tell you the understanding, I will give you the plan, and then all you just need to do is study and what pass. And I can guarantee you, you're going to pass in it 5 questions. I'm trying to walk you through a process. Now, the last part is understanding that NCLEX question have 3 parts. Now, if you miss anything, right, don't miss this thing. Right, the reason why is this: if you see your NCLEX question, now, let me show you this NCLEX question right here. Now, when I'm seeing this NCLEX question, there's 3 things I want to understand about this question, because nursing school question is different from NCLEX question. Like I said, in nursing school, all you just want to figure out is the question. But on the NCLEX, you want to figure out the question and you want to figure out the answer keys. And to every NCLEX question, there's 2 parts. And the answer key is just the last part, right? There's 3 parts. I mean, there are 2 parts from the question, and the answer key 1 part, right? But NCLEX, so nursing school, you just need to figure out the question. The answers are straightforward. Now, let me tell you this: NCLEX, you need to figure out what is the examiner testing, what is the question that the examiner is asking, and then you need to answer every mini question that you write here. Every answer key is a mini question on its own. That is what a lot of students don't know, because they don't know how NCLEX writes the question. That's the big problem. We know nursing school question is about knowledge base, so there's no any tricky kind of answer in nursing school. But the NCLEX exam, they are tricky kind of answer. So you need to figure out those particular things. And NCLEX is not trying to do that. When students say NCLEX is very tricky, no, NCLEX is not tricky. NCLEX is doing that to be able to know if you are a safe nurse. Because if NCLEX don't do the answers like that, how would they be able to know you are a safe nurse? There's no thinking process. You just easily see the answer and just be able to say this is the correct answer. Make no sense. Then we don't need to have NCLEX exam. We just need to finish nursing school and immediately what become a nurse, right? But the NCLEX exam is there to uh to make sure that safe nurses are the one that are being what are the one that are what getting the license. That is what the NCLEX is all about. Am I making sense? Now, um, pay attention to this question, right? Pay attention to this question. Now, the first thing I will be thinking about in this question is what? What's the NCLEX testing? As I said, NCLEX question have 3 parts, right? It have the body, it have the stem, and then it have the answer keys. The reason why you need to know this is because they are very important. Now, the body of the question contain the content. Remember, I said NCLEX have content for what? RN, and have a content for PN. The content is 146 and then 150 content for PN. Now, if you have gone through this content, which in my course program within the first 30 days, you would have gone through this content, right? 30 days, right? Now, if you have gone through this content, then you have the ability to spot what the NCLEX is testing. Is that not awesome? Because most students go on the NCLEX exam, they don't even know what the examiner is testing. I can tell you this, right? You know yourself, right? You might say, oh, boy, most time know what the examiner is testing, but not until maybe I give you 1 or 2 questions and then you are like, oh, or maybe you listening to me answering some certain question and you are being like, oh, I never knew this, right? I see this all the time, right? Now, NCLEX is testing a specific content. The content is, you can easily know what the NCLEX is testing. The problem is that you miss out on the content of the NCLEX exam. When a lot of students hear learning content for the NCLEX exam, they think about it like a particular program have content, so that is it. No, you yourself need to know the content so that you are sure, right, that the same content that NCLEX want to test is the same content that that particular program is also teaching you about. Right? Most program don't teach you on content. They just teach you on random stuff they feel is important in nursing school. I'm telling you, most program have been existing for long. Now to revise everything that they have done is not possible again. Why? Because if they revise what they have done, it will put them out of market for a while before they get back. Right. But now, the truth is this: anytime students take the NCLEX exam each month or every 3 months, at least minimum 80% of students pass the exam. And this is a good pass rate that a lot of programs rely on. Because they think about it this way: if 80% of students can pass the exam and leaving only just 20% of students failing, this is still a good way to still proceed with whatever they have. Because at the end of the day, students are not failing. But my concern right now is not about people that are passing, it's about people that are failing. I've seen someone who failed 14 times. Well, I helped this particular student pass on her 15 attempt, but it's painful. She might have given up. I've seen someone giving up on her 7th attempt. I've seen someone giving up on her 2nd attempt. Right, I've seen someone giving up on her 2nd attempt. Unlike these people that got here. So I'm more concerned about these people because these people also they are amazing, they are smart, they want to become a nurse. They can even be better than most of the people that pass the exam. So true, a lot of students are passing, but there are a lot of people struggling. So I want to help these people that are struggling so that they can be able to pass. And that's the reason why I wish to tell people, right? Okay, let's do this together. Now, I had a particular student who failed the exam 7 times. Now, 7 multiplied by, like, she was doing question bank programs, right? She said, I asked her what we're using to study. She listed a lot. I said, okay, were you answering all these questions successfully? She always used to answer it. Now, minimum question is in each of those question banks is what? 2,000. She even told me she used a particular question bank that had 4,000 questions. She completed all this, but she still kept failing. But let me just say minimum question of each question bank is 1,000. So that is 7,000 questions. She started taking the NCLEX exam when it was 75 to 265 questions, right? Then when it was 85 now to 150 question. Now, if 7,000 questions from question bank and also maybe 1,000 worth of questions that she have done in nursing school program, which make it what? 8,000 plus of questions, right? Knowledge, right? Content knowledge, and then she's unable to pass in 7 different attempts from 75 question, from 85 question, or anywhere from 76 to 265 question, or anywhere from 86 to 150 question, and she still what? Always fail the exam. Then there's a big problem. So I don't know whether most students don't take their time to think, because I feel like most students don't take their time to think. The next thing when they fail is people that we message you and we say, oh, don't worry, try again, you are going to get it right the next time, and all that kind of stuff. I feel like most people still need to think and ask themselves, why am I failing? Because the moment you ask yourself, why am I failing, you will have a reason. But the truth is this, let me tell you, I understand why you still keep on doing the same thing over and over again. Because now, the moment you're asking yourself that, why am I failing? The next thing is that you are seeing your colleague who have passed the exam. You believe uh in that your colleague. So when your colleague is like, oh, I use this particular program to pass, use it as well too. You are not even thinking about you have an existing problem that is not making you to pass. Instead, the next thing you are thinking about is, if that colleague can use that program to pass, I should use that program to pass. Let me tell you the truth, program don't make you fail. Because think about it this way: I've seen a particular student who have 90%, right, in a particular program, popular program, and she still failed the exam. And I've seen a particular student who have 50%, right, did not cover every question on that program and still pass. Now ask yourself this one question: don't you notice that that same program you feel let you down, that made you fail the exam, is still that same program that make a lot of students to pass? So it's not about the program, it's about the existing knowledge. If you don't work on the existing knowledge, then it's going to be a problem for you. It's going to be what? A problem for you. So the program don't make you fail, it's your existing knowledge. Start thinking about it this way. The moment you can fix this existing knowledge, you are going to pass the exam. And that's the main reason why I wish you to tell students this. There are 3 reasons why a lot of students keep failing the exam. When I do this with every student, they all pass the exam in 85 questions. One, knowing your content. Two, knowing how the NCLEX write the question. And three, trying to understand it. That's what we are about to do very soon. Now, content is not just by saying, oh, this question bank have content. No, you need to find out if those content are related to what the NCLEX is saying. Some question bank content are not related to what the NCLEX is saying. That is what you need to find out. That's one. Two, now you need to get the NCLEX past question first, not question bank program. You need the NCLEX past question first. So you start learning how the NCLEX write the question. I've done analysis of 1,940 NCLEX past question, and I noticed that NCLEX only have 62 ways of writing the question. They will write the questions the same way, but it's testing a different content. Now, I will explain something real quick. Let me just explain this real quick. I wish to tell my students this, but I will say this here. Right, I will say this here. Now, NCLEX is testing your ability to practice, and it's testing your ability to become what? A safe nurse. Now, the practice area is just like in nursing school, right? Nursing school introduce you to courses, right? Because they want to test your knowledge related to what each courses. But NCLEX is no more trying to test your knowledge. NCLEX is trying to see if you can use that knowledge to what? Practice. Am I making sense? NCLEX is trying to see if you can use that knowledge to practice. Now, the practice area is what you want to know. NCLEX is putting you what? In a hospital settings. Nursing school is putting you in classes. Am I making sense? NCLEX is putting you in hospital settings, and nursing school is putting you in classes. NCLEX is putting you in hospital settings. You need to know that. Now, when you are taking the NCLEX, it's a transition from being a nursing student to what? Being a nurse. The only difference between you that you are taking the NCLEX exam and you are showing that you can practice as a nurse, and somebody that is working as a nurse physically, is that you are practicing as a nurse in form of what? Exam, and this particular person is doing it physically because they have the existing license. So what is stopping you right now from becoming this nurse is the fact that you don't have the license yet. So you are trying to cross the bridge of this exam to get the license by showing that you can practice. Now, in nursing school, you can mention your courses: med-surg, anatomy, right, pharmacology, and a lot more. Same way, you should be able to know the area of practice related to the NCLEX exam. Now, when a lot of students fail the exam, right, they tend to know this, and that is the point. They know it. You get what? A test report. That test report will tell you how you performed. Do you notice that the same test report you are getting is the same test report another student who failed that same similar exam is getting as well too? There's no different test report. If it is RN, it have the same test report. If it is PN, the same test report. Now, so if we have all these test reports, right? Now, what is the test report telling you? The test report is telling you how you perform in each practice area. We have 8 practice area. I call them the 8 client need. I'm going to list them for you related to RN and the PN. Now, the first part for RN and PN, RN is management of care. For PN, it's coordinated care. Now, if you have failed the NCLEX exam before, take a look at your test report and go alongside with what I'm saying. Now, the next part is safety and infection control for both, right? Next part is health promotion and maintenance for both. Now, next part is psychosocial integrity for both, right? Next part is basic care and comfort for both. Next part is your pharmacology. But the difference between RN and PN is that NCLEX tests pharmacology and parenteral therapy for RN, but it's only pharmacology for PN. Now, the next part is your reduction of risk, and the last part is your physiological adaptation. I listed it in the same order. And all these things I'm listing, right? I'm just saying it without not looking at it. So you have that ability if you are truly ready to become a nurse, right? If you are truly ready to become a nurse, you will have that same ability to list these things out without not even looking at it. Right. I don't have to look at it because when I was preparing for the exam, I noticed I needed this knowledge. So I pay attention to what will make me pass. And that's the reason why I had the ability to pass the exam in 85 questions in just 2 hours. You understand? So you definitely have that ability as well to pass the exam. And I'm definitely going to give you this ability as well to if you join my coaching program. Now, NCLEX is testing on the practice area. You need to know that. So when you know those practice area, now you know NCLEX wants you to practice related to these 8 what area? 1, 2, 3, 4, 5, 6, 7, 8. Right? So now, if NCLEX is telling you as the nurse, the RN, I want you to manage care. What kind of care are you managing? If you go on the test plan, you are going to see a list of cares that you are managing. Now, if you go on the test plan under the management of care session, you are going to see advanced directive. That is the first thing right there. Advanced directive, followed by what? Delegation and supervision. That is the second thing right there. If you go on the PN as well too, you are going to as well to see the content related to what? Coordinated care. That is how you think about it. So, okay, NCLEX want to test my practicing related to what? Management of care. So, what are the things NCLEX will be testing me? You are going to see it. Check safety and infection control. Check every other client's need as well too. You are going to see audio content. When I counted all this content, that was when I noticed that RN have what? 146 content and PN have what? 150 content. Am I making sense? All right. Now, the moment you know this content, you cannot go on the NCLEX exam and see the body of your question, and you will say you don't know what the question is testing you, except if you don't know how to identify the body of your question, which I'm going to show you very soon. Now, guess what? We know how to identify the content. You now need the knowledge related to each content. That is what you are going to get in my coaching program, because now on the test plan it's all listed, but there's no knowledge related. So on my coaching program, you are going to get the content related to each of these what the knowledge related to each of the content. You're going to get it right, and that's what we do for the first 30 days. Content. So you have the ability to see your question and be able to identify this is what the question is testing, right? All right, so that is the first part. Now, how NCLEX tests you to what? Be a safe nurse is using what we call the 6 concept. A lot of students don't know this. It just look like I'm saying things that most people don't really know, and they are like, wow, so I needed all these things but I did not know it, and I'm only focusing on what? Question bank. Right, thank me later. Now, this is it. NCLEX will pick a specific content, and then they are going to look at the list of this concept and test any of these, right, related to this content. Now, if the NCLEX examiner decides to test on advanced directive, she will look at this concept and decide which of these concepts she's going to decide which of these concepts she want to test you on. It's just like now she have an option. This is it. Now, people that write the NCLEX exam are like me and you as well too, right? But you just need to meet a certain what criteria to be able to write the NCLEX exam. Now, but they will give you a guideline. So it's this guideline that they give the examiner that I'm telling you right now. Now, they give the guideline this way for the examiner to pick any what content. Now, she will not just pick content randomly. Every content has been distributed in form of what? Percentage, right? In form of what? Percentage. So now she's not going to go beyond the amount of questions she should test for management of care. She's not going to go beyond the amount of questions she should test for coordinated care. Like management of care on the NCLEX exam, she need to test 18% question, right? Coordinated care, she need to test 21% question. If you check your test plan, this is what you are going to see, right? So now when she want to test question, she might say, okay, 18%, let's do the math. Let's do the math real quick, right? So all you just need to do is 18 divided by 100. I always used to help my student to pass the exam in 85 questions, so I'm going to multiply it by what? 85 questions. So that is 18 divided by 100 multiplied by 85 questions. That is at least 15 questions that you're going to get from management of care. Let's do the one for PN, which is coordinated care. 21 divided by 100 multiplied by 85 question. That is 17 question minimum. Let's just put it 18. Let's round it off. So that is 21 divided by 100 multiplied by 85 question. Right. So that is 18 question. Right. That you're going to get from coordinated care. This is 15 question out of what? 85 question. This is 18 question out of what? 85 question. Imagine you have studied all the content you need to know for management of care. Management of care content is 24. For RN, coordinated care is 30. Right. Imagine you know this 24 content and you are preparing for what? 15 question and what? 18 question. Guess what? Go and check your test plan again. You might notice, oh, you are near the passing standard or below the passing standard. Right. This time around, you're going to have above the passing standard. You can see how I'm trying to help you out. You can see how it's going to be possible to pass the NCLEX exam even when you have failed the NCLEX exam multiple times when you join my coaching program. You can see how I am giving you a roadmap. You can see how I'm giving you a clear path. Because a lot of students think it's about question bank. How many question bank have you done? How many content have you studied? Ask yourself this question. And you keep failing the exam. Do you think it's about the question bank? No, you need to understand the exam, follow a certain path, a roadmap, which I've created in my coaching program that will help you to pass the exam. Right. You don't need to do this stress that keep you to pay more $200, waste your time by giving you 45 days. Most students even have limits. Right, some states we only ask you to take the exam 3 times. I have a particular student who failed twice. Joined my coaching program when she said, "Oh, she just have one more time to take it," and she passed on that attempt. Right, day one, she messaged me, "Coach, I'm scared." I said, "Don't worry, we've done all the whole process." Because there's one thing for you to go through the process and take the exam. There's one thing for me to make sure that you are not just going through the process, you are understanding it. Because I don't just allow you go through the process. No, I will evaluate it that you understand everything. I will make sure that you are 100% ready to take the exam. I don't just allow students to take the exam, except if you decide and you say you want to take it on your own, on your decision. But if you want to follow my opinion, trust me, I will make sure that you are good with each content before taking the exam. Because it makes no sense to me you are not ready and you are taking the NCLEX exam. Why wasting money? Why wasting time? Why giving yourself emotional problem? Because now when students fail the exam, they feel they are not fit for it. They feel like they can never pass. Right? Delay, embarrassment. So these are what a lot of students face. The last time I was hearing a particular lady telling me her daughter said why is she failing the exam, that she's sure that she will finish high school and her mother will not pass the exam. I'm like, wow, your daughter is telling you this. That is scary to me, right? So these are things a lot of people face behind the scene that we don't know. We just only try to encourage them and say, okay, try again later, use this question bank. It's beyond telling them to use question bank. They need to understand something about themselves that keep making them to fail the exam. There's a particular student that said she has tried everything possible to pass the exam and she did not pass. Now, on my first encounter with this student, I asked this student one question. I said, all right, let me try to evaluate because I use this process, right? 8 by 8 add pi or 8 pi can definitely work for a lot of things. A lot of people don't know it's like a basic like structure for a lot of people. Now I try to assess the student, try to create the problem that this student try to see the problem that this student have, plan, then we implement it and then I evaluate. This is what I do. A lot of like guess what? Your question bank, do they have the ability to evaluate whether you are knowing what you know or not? Obviously no. Because there's nobody there to evaluate you, right? There's nobody there to evaluate you. Who is going to evaluate you than the rationale that you are getting? So you don't even know if you are getting your thinking right or not. A particular student sent me a particular question one time. She got the answer. She was so excited. So she sent rationale to me. If she never sent rationale to me, I would never even know that she don't understand the question. She got the question right, but the rationale was totally wrong. And that is it. Most time our thinking is just related to one specific thing, and sometimes it helps us to select the right answer. Sometimes it will not. That's the reason why a lot of students fail. Right. That's the reason why a lot of students fail. There's no one thinking on the NCLEX exam. You think related to various things, but it should link back to what? One thing, which is the patient and what make the patient exist in the first place. Am I making sense? This is another story for another day because if I go into this, oh my goodness. Right, because one thing a lot of students don't know is that it's one patient that we're caring for, and we do a lot of things to this patient: medication, procedure, treatment, surgery, ethical things to just one patient. So, what make this one patient exist that make you do all these things? Guess what? Is the ability for everything in the body to work. And what makes everything in the body to work? That is the body system. So the whole goal of passing the exam is understanding this one key thing and everything that make it to work, or what shows that it is working or not working, and you'll be able to pass the exam in 85 questions. NCLEX is not difficult. Right. There's a lot of things I want to say, but I don't really want to go into this right now. so that I don't miss out what I want to say. So I assess this student, right? And I noticed that okay, she have failed many times and she said she don't know what she's doing. Okay, let me see what you know. Now I asked the student, which of the following, right? I said the vein, the artery. Which of them are you going to feel for what? Pause. She said, pause, pause, pause. She said vein. Now, ask yourself, do we feel for pause in the vein or what? Artery. Right. So if you say vein, or if you say artery, vein is wrong, artery is correct. Now she said vein. I was like, okay, maybe that was something she was not expecting. Like I give benefit of doubt, right? So I gave another question again. I said, where is the heart located? Right. So a Zoom meeting. So our camera was on. So I said she should point. Right. And then she was pointing to somewhere around that what? Like it was not clear. I said, okay, maybe maybe I just said, okay, I was just giving a benefit of the doubt again. I said, where is the um liver located? She don't also know as well too. Then I was like, okay. Now, if you don't know all this, how do you want to pass what? Case study. How do you want to pass case study? How do you want to pass both eye question? How do you want to pass chat question? How do you want to pass clinical judgment question? Right? Clinical judgment question. And the whole new generation NCLEX exam is related to clinical judgment. So how do you want to pass the exam when you don't know this? And she's saying, oh, she don't know the reason why she's failing. She have tried every program. So have you tried to study where the heart is located? Have you tried to study where the liver is located? Have you tried to correct the mistake that the vein is not where you feel for pause and is the artery? No, she has not done all this. But what her concern is that she has tried every program and then every program none has helped her to pass. The problem is the program is not what is the program is not what is making her fail. She's the one that is failing herself. The ability not to know why she's failing is the problem. These students feel like if she finished 2000 program, in as much she can cover what the rationale to the correct and wrong answer, she should be good without not revising everything that she failed to know in nursing school. I asked her one question: are you ready to study? She said it's been 2 years, but she feel like she's ready. You feel like you are ready? You should be ready if you care to be what? A nurse. At that point, I knew she's not going to be a good fit to join my coaching program, and that was where I ended it. Because I need students that are committed, I need students that are serious, I need students that are ready to pass the exam. I don't joke. Right. I'm ready to sacrifice my time, my energy, everything to make you pass. But let it worth it to both me and you. Because you don't only need the pass, I also need the pass in order to encourage most students that I've seen giving up, right, to know that they can pass. Right. So now there's one thing I want to add before we go to that tutorial question, right? Which is the aspect of below, near the passing standard. I feel a lot of students need to know this, right? Now, the NCLEX use 0.00 for RN passing standard, negative 0.18 for PN, right? So this is the passing standard line, 00 for RN, and right here you have a particular line right here. In between, this is near, this is below, and this is what? Above. Now, at the end of what? Your 85 question, if you are within this line, it is borderline. So NCLEX will start giving you what? 86 question all the way to 150 question till maybe stop anywhere in between, or you take all 150 question. And at the end of the day, it will decide if you pass or what? Fail. Right. But if you are here, like now, if you are checking your what are they calling your test report, and then you are seeing near the passing standard, it means that you are somewhere anywhere around there. If you are around there, you are above. If you are around there, you are below. If you are saying that you are below, it means that you are around here. You've dropped past what? This line. Right. If you are within this line, borderline, if you are within this area near, if you are within this area below, if you are within this area above. Now you understand how above, near, below work. Right. Now, one question a lot of students used to ask is that, do I need to be above the passing standard in every areas? The answer is no. The answer is what? No, you don't need to be above the passing standard in every area. Right. The thing is this. Let me explain something for you so you understand. Right. Let me explain something. I will talk about the PNO now, but let me explain something to you so that you understand real quick. Right. Now, this is it, right? the it's just like nursing school exam, right? Maybe you are attempting 100 question. Maybe the passing standard. I said the passing standard. Let's say the pass mark is 70 over 100. That is the same way NCLEX also work. Let me tell you the truth. A lot of people will tell you NCLEX don't have a pass mark. In reality, NCLEX have a pass mark, but they cannot rely on a pass mark because of the nature of the exam. And I'm going to tell you why. Now, this is it. NCLEX have minimum 85 question and maximum 150 question for both RN and PN. Now, follow me. Now, on the NCLEX exam, unlike nursing school exam, 100 question matters. On the NCLEX exam, right, 15 question is not going to be scored. Only 70 question will be what? Scored. Right. So even if I'm talking about in 85 question, because if you add it all together, it's what? 85. But if it's in 150 question, let us say you attempted all the 150 question, 15 question is not going to be scored, right? 15 question is not going to be scored. Uh, and then you have what? 135 question that is going to be what? Scored if you attempted all the 150 question. Same maths apply to if you attempted question anywhere between 86 to what? 150 question. Let us say a particular student now, she said her exam stopped in 135 questions. So all you just need to do is to minus 15 question, meaning 15 question was not scored, only 120 question was what? Scored. Are you understanding what I'm saying? You don't see that in nursing school question, right? But it's on the NCLEX exam. Now, the reason why we have this 15 unscored question is not to put you into trouble, but these 15 unscored question are questions that are written by the NCLEX examiner, right? They are new questions written by the NCLEX examiner. So they are trying to experiment this question to see if 95% of students can answer it correctly. Now, if 95% of students answer those questions correctly, then they are going to start putting those questions into what? The new question bank of the NCLEX, right? The new, because NCLEX have thousands of question bank. NCLEX started 1944, if I'm not mistaken. Let me check that real quick. When the NCLEX started, let me check that real quick. Oh, no, not 1994. That's what I'm seeing right here. NCLEX started in 1982. That's what I'm seeing here. I'm seeing a lot of, yeah, 1982. It was replaced by a particular state board. Right now, the NCSBN was created in 1978. The NCSBN is the writer of the NCLEX exam. Right. Maybe previously, before the NCLEX have been generating their question, but later on, they created what? The NCSBN to write the exam. Right. So in April, NCLEX, okay, 1944 is when NCLEX started using what? The CAT. Right, the CAT. Previously, before, right, NCLEX, this I know this one. NCLEX had 700 plus question. Now we have we are lucky, right? Now we only answer what? 85 to 150 questions. Previously, before, NCLEX question was what? 700 plus, right? And they don't take it in a day, they take it for days. Right, I don't know how many each day, but they take it for days, right? But now we answer it later reduced to 400 plus. Then later from 400 plus, it reduced to what? 75. Now before it was like 700 question, 400 question plus, but now it's now between it's not something that we have 85 or 150 question. So 75 to 265 question, it reduced to 75 to 265 question, and now we have what? 85 to 150 question. Maybe a lot of students complain and they were like, oh, the question is too much, the question is that, and something like that. Maybe the mindset of the examiner is to make you do as much as possible question to show that you are a safe nurse, right? That was the mindset then. But now, since maybe students complain or maybe they feel like it's too harsh on the student, they now said, okay, let us give you the opportunity to pass with minimum 75 questions. Right. And then if you don't pass, then we start giving you more questions. Most of the time I think about it I think about it this way, that NCLEX sets the top priority question that tests the highest safety in nursing practice in your first 75 question. And then when you did not pass in the first 75 question, every other question maybe start coming from random areas. I think about it that way as well too. Now, same with 85, that's the same thinking I have about it. Right, but that's the main reason why when I was creating my program, I decided to stick to what the 5 key areas. Right, remember I said you don't need to be above the passing standard in all areas. I'm still trying to like explain it, so I stick to what the 5 key areas. These 5 key areas give you 73% knowledge of what you need to know for the NCLEX exam related to RN, and 71% knowledge of what you need to know for PN exam in order to pass in 85 questions. Like if you know these things, trust me, you are going to pass in 85 questions. There's nothing, I repeat, nothing stopping you from passing the exam in 85 questions. Listening to me now, I'm giving you my knowledge. You can say I know a lot about the NCLEX. I'm like, I had to know all this in order to pass in 85 questions and pass in 2 hours. So if it works, all these things I know right now, you don't need to know it because I've done the whole knowing process for you. Now all you just need to do is to follow a pattern, because now if you know all these things I know, the next thing you will start thinking is how do you plan with it? That's the next thing you will start thinking, because now you know I told you we have 3 phases to understanding the NCLEX: knowing about the NCLEX, planning, and then study. Right. But if you know all these things, guess what? Your next journey is to plan. You might not be able to plan because you might not be able to put all these things together. So instead of doing that stress, I've done this planning process for you. I've done the knowing process for you. I've done the planning process for you. All you just need to do is to join my 8 weeks coaching program and then pass the exam successfully. That is just what you need to do. That's just what you need to do. Right. And yeah, because I did not just put up my coaching program just to make students answer questions. No, I don't even have a question bank on my coaching program. All I just have is content. Right. And we work together using what the NCLEX past question. So all I focus on is the NCLEX past question. Everybody have access to this document. It's on the NCLEX website. I can send it to you. You should have access to it. Now, this is what I've been doing for the past 2 years. And when students do the same thing, they end up passing the NCLEX exam. So that is it. So that is the main reason why I wish you to tell you, if you want to get question bank, fine. But if you don't want to get, you are still definitely going to pass, because question bank don't really matters. What matter is you know the content. Because if you are trying to answer that question, it's because you are trying to test a particular content knowledge. If you don't have the content knowledge, the question is not going to make sense anyways. But if you know how the NCLEX write the question, you learn your content, right? If you know how the NCLEX write the question, you learn your content, you go on the NCLEX exam, you are going to pass, right? So that is it. Now, as I was saying, right? So you understand the process of what the question. Now let me do something right now. So let me talk about the RN, the PN. I mean, now this is the logits, and then you have the 0.18 right here, right. So you have this line right here. So here is the near, here's the below, right, and here's the above. You can see PN have more grace, right? If you are here, you are not below the passing standard, you are not near the passing standard. Unlike NCLEX, unlike NCLEX-RN, if you are here, you are what? Below the passing standard, right? Sorry, you are near the passing standard. But if you are here, you are below the passing standard for RM. But now for PN, if you are here, you are near the passing standard. If you are here, you are below the passing standard. So you still have more grace, right? And PN is not difficult, right? A lot of students that fail PN exam, I always used to tell them the secret and they pass, right? It's less stress than RN, right? It's more of knowledge. Right, you can easily cram, memorize things, and pass PN. But I don't encourage memorizing and cram because I never did any of that. But I'm just putting that out there, right? Now let's go back to our maths. Right. So 15 question will not be scored, right? Because I explained why. Now you are left with please bear with me because I'll be using 85 question, because mm, like the highest students who have done my program and passed the exam in what, 92 questions, right? The students who fail 14 times, I've been saying this in many videos, right, pass our exam in 86 questions. The student who struggle 7 times, right, after giving up for a long period of time, pass our exam in 85 questions, right? So this is my goal, right, to help students pass the exam in 85 questions. That's the main reason I wish you to talk about 85 questions. So bear with me, right? So now 15 questions out of this is going to give you what, 70 questions. Now this is it. Passing standard, look at the passing standard 0.00 for RN. So 0.00 for RN is midline, right? Which is 70 divided by 2, that is 35. So 35 question is going to put you borderline. If you get 35 question correctly, 35 question incorrect, you're going to be what? Borderline. But now, the reason why this is not realistic is because of this 15 question. Because this 15 unscored question, we don't know it. If we know this 15 unscored question now, it's going to make sense. We don't know the 15 unscored question. We get our 85 question, but we don't know the 15 unscored question. That is the reason why NCLEX is not having a pass rate, or NCLEX is not having a pass mark, I mean. Because there's no how a pass mark can be introduced when this is happening in your question. Because guess what? If a pass mark is introduced, you don't know whether this 15 question is going to be part of the 35 question you are going to get correctly, because you also still have to answer it correctly as well too. Right? It's just that it's not going to be scored even if you answer it correctly. So you don't even know if those 15 questions is going to be out of your 35 question. Let us say 7 of those questions is part of your 35 and you failed 8 of those questions. Now, if we remove just like that, let us say we remove, okay, let me do it like this. 85 divided by 2. Let's do it this way. 85 divided by 2. Let's do it this way. So that is 42. So now let me clean up so that I can just make a clean list. Right. So this is it right here. We are still talking about this, right? Right. So you have 42.5 right here. You have 42.5. Now, 15 is unscored. Remember, I did 85. So we have any of the 15 question can be either here. Any of the 15 question can be either here. So if every of your 15 question is here, then guess what? This is a clear borderline, because obviously you missed all the 15 question right here. But the chance of every 15 question to be right here as all the question you miss is low. Am I making sense? It's low, because even if 14 question is right here, there's that chance that one question that you that is unscored will be here too. Right? So now if NCLEX remove that one question that will be unscored, you are 41. The moment NCLEX just remove that one question that is unscored, you drop below the passing standard. That one question that is unscored, if NCLEX remove it from this 42 question you got correctly, you immediately drop what? Below the passing standard. You can see that's the reason why NCLEX don't have a pass rate or something like that. But guess what? Look at a clear math. Look at a clear maths that I want to do for you right now. Now, this is how I always used to think about it. That's the reason why I always used to have a clear pathway to help students, and I know what they need to focus. 85 questions on the exam, right? 15 will not be scored. Now you are left with what? 70. 70 divided by 2, that is 35. Now 35 plus 15, right? We have 50. Right. At this point, if we have 15 and 35 questions, this is going to put us borderline. So it takes 50 questions to put you what? 50 over 85 to put you what? Borderline. So if you have 51, like one more question correctly, you're going to what? Be above the passing standard. So the ideal score on the NCLEX exam should be 51 over 85 questions. So you need to score minimum 51 question over 85. But guess what? You know, we are going on the NCLEX exam. We don't know the unscored question. We don't know the score question. We are just treating every question like they are going to be what? Scored. So with that sense, this is the math. But at the end of the day, we don't know the unscored question. So we cannot really focus on the maths, but this is the maths that definitely make you pass. If you are passing with 1 point, this is what make you pass in 1 point. So now I looked at it and I asked myself, what can the students study that will give them the maximum knowledge of the exam? That's when I paid attention to the distribution. And I noticed if you focus on the 5 key area for these two exams, RN and PN, for RN, right, it gives you 73%. PN, it give you what? 71%. So if you focus on this and focus on your case study, bow tie, and chart question, you will 100% pass the exam in 85 questions. I don't know where you are coming from. I don't know what you struggle with. I don't know how many times you have failed the exam. But if you follow this process, what I can guarantee you 100% is that you are going to be a nurse. That is what I know. You are going to be a nurse. That is what I definitely know. Right. So because I've done everything, I've seen everything, and I can easily tell. NCLEX introduced what? The new generation exam because of these 3 things. Now, the moment you can focus on these 3 things and these 2 parts, which are the 5 key things for your specific exam, you are going to pass that exam successfully. Now, back to the real problem that we started with. The real problem that caused a lot of students to feel that NCLEX answer all look the same. Now, let's talk about that real quick. A lot of them say, oh, how the answers look the same? This. Now, there are two reasons why answers look the same. One, keywords, right? Keywords. There are some keywords that is directly telling you that we have more than one answer, but we just want you to pick one answer. Like now, NCLEX is saying, what should the nurse do first? It means that the nurse can do this, do this, do this, do this, but NCLEX is just telling you to select what the nurse can do first. Am I making sense? Now, let me give you another keyword, right? Um, Now let us say another keyword is this most important, right? Another keyword is this most important. Now, this most important keyword means that everything are important, but you just need to select the one that is what most important. Another keyword is priority, right? What NCLEX is just trying to tell you is that everything are important, but you need to select the one that is priority. Now, let me now tell you something that you need to know, right? Real quick. Because I want you to be able to understand everything that will help you to pass the NCLEX exam. Right. Now, this is it. If you check your textbook, right, your textbook will give you a certain situation and tell you the nursing action. Your textbook will give you a certain situation and tell you what? The nursing action. Now, this is it. The nursing action are just listed on your textbook. Now, it's the duty of your lecturer, right, to now explain each of these action and how you apply them to any situation. Now, you might be saying, okay, now that the NCLEX is asking you what should you do first, why is it that we don't have a textbook that is telling us that this is what you need to do first before you do this next and so on and so forth? The reason why is because what you do first is related to the situation. Situation can change. Your textbook cannot really tell you about every situation, but by you understanding that situation, maybe it's a disease process. By you understanding the disease process, you can easily know what to apply. Right? It's just like now, a patient who have COPD, according to the disease process, right? They have what chronic bronchitis, right? And they have what chronic emphysema. Now, due to that disease process, they can be tightening of the airway, and also there can be problem with what the air sac as well too. So now you understand that this patient can either way have difficulty breathing or lose what oxygen. That is the main reason why, because of this process, these two chronic problem, COPD cannot afford themselves too much oxygen than what 88 to what 92%, unlike a regular person that have what 95 to what 100%. Now, COPD have that ability to have 95 to 100% oxygen, but they will not be able to like handle anything higher than 92. That is the main reason why, if you give a patient who have COPD any oxygen and they are starting to have 93 and above, instead of them to normally 95 you breathe well with it, right? Instead of them to breathe perfectly fine with it, guess what? They will now start developing what difficulty in breathing. Then you'll be asking yourself, but am I not trying to help these COPD patients? 82 to 92 is not enough oxygen for them, but I'm trying to help them to up it up to 95 to 100. But guess what? You are trying to up it up to 95 to 100, but you are causing the COPD client a big problem, because this is only what a COPD patient can handle, 88 to 92. And why? Because of what? The disease process. Now, you will not be able to know that, because either way, COPD experience low oxygen. Asthma, a patient who have asthma also experience what? Low oxygen. But what is low for COPD is not what is low for what are they calling it? For asthma. Now, your nursing textbook cannot now tell you that, oh, when you want to give oxygen, and give you a general value for anything or give you a general value for what is low. No, you have to now figure out what is the situation. In this situation is COPD, in this situation is asthma, and be able to apply what is related. So this is the job of your lecturer, to explain all these things to you. But the problem is that a lot of students don't gain this understanding from the lecturer, right? And they don't even gain a roadmap. Let me tell you something. Even if you are going to ask a student to do something by themselves, at least they should be clear about what they are doing by themselves, right? Like now, if I'm going to give you assignment, I will not only give you assignment, I will give you how to approach the assignment, right? And then you can be able to figure it out yourself. There's one thing to give a student assignment, there's another thing to give them how to approach it, so that they can easily figure it out, right? There's one thing to tell a student to go and read a specific content themselves, and there's one thing to tell them what they need to focus on. Because if they don't know what they are going to focus on, they will be all over the place, right? But if you give them where to focus on when they are reading, they will get the necessary knowledge that you want them to get. Now, a lot of lecturers don't do that, so they force students to go on YouTube to get information, and then when they get information on YouTube, they are not having a clear pathway to that information, despite the fact they feel like, oh, it's a 2-minute video teaching, and then I learn everything from that video. It's a 10-minute video teaching, I learned. Some student will say, you taught me what I've been struggling to learn 2 years in nursing school, right? But in reality, what they learned is not linked. That is the problem. You learned that thing, so it becomes a stand-alone form of learning. That learning is not linked back to the source. The moment your learning is not linked back to the source, this is the problem, because NCLEX don't test stand-alone form of learning. NCLEX tests source of understanding. That is the main reason why a lot of students will go on the NCLEX exam, they will see the question looking familiar, and they are still going to get it wrong, because they don't understand a lot of things about the exam. Now, the reason why I said it depends on the situation is this. Let me give you an example now. If a patient is having shortness of breath, right? If a patient is having shortness of breath, what are you thinking of doing? I know you are mentioning what? Elevate the head of the bed. This is common. But let me tell you the truth. NCLEX is saying shortness of breath, what should you not do first? It depends on the situation, because NCLEX can have one of your answer key, right? Maybe number one to be what? Elevate the head of the bed. But elevate the head of the bed will not be correct to every situation. 90, let me say 80% is going to be correct to every situation, but 20% is not going to be correct to a patient that is having stridor, right? Or yes, stridor, like a pediatric patient that's having stridor, because you are suspecting um airway that is what? Blocked. When a patient is having this, right? Or you are suspecting epiglottitis, right? Now, when you are suspecting that, which is this is one of the sign, right? You are not trying to elevate the head of the bed. Instead, what you are trying to do, your immediate action, which is the first thing you need to do, is to prepare for what? Intubation. To prepare for what? Intubation. That's the first thing. So guess what? You are going to see this as part of your answer key on the NCLEX exam. But because you understand this general knowledge, you will likely select that as your answer. Now, when you check the answer, then you will not be shocked, and you be like, oh, so, but I thought it's the answer. You see the problem? Because what you do first is related to the situation. Now, let me give you another one. Guillain-Barré syndrome, GBS, right? This condition, the patient can have generalized weakness, right, or paralysis, and then the patient will have shortness of breath. Guess what? NCLEX is my put elevate the head of the bed. Elevating the head of the bed will not still be correct related to this situation that this patient is having shortness of breath. Instead, preparing for what? Intubation is the answer as well too, because you are going to see the answer related. You can see now they all have the same thing in common, which is shortness of breath, but it is not the correct first action for this situation. So you need to understand the situation to know what is first. Right. Now, I'm trying to think about another example. Let me think. Okay, I feel like that is. I feel like I'm missing something, a particular example that I can add, but right, but it's fine. I pretty much, like, I've given you a lot, guys, a lot. Now and now I know you'll be able to like critically think about most things on the NCLEX exam. Now that is the situation that I have to do with keywords that make you decide specific answers, right? That make you what? Decide specific what? Answers. So we need to be what? A critical thinker that understand how the NCLEX is asking the question. Now, another way NCLEX test the question is related to uh what I call this is my rule. I don't just know how to say it, so I just call it the 70-100% rule. Right. In a sense that all your answer will be written in form of either like now, this particular question you can see, right? Some answer are written 70% to like three answers are written 70% to be correct, and then 30% to be incorrect. And only one is written 100% to be correct. So you need to always spot out that 30% that make your answer incorrect. So that is the second way NCLEX write the answer keys. Now, I feel this way is the 90% way NCLEX write the exam question that cause a lot of students to feel all answer look correct, because the NCLEX will make sure that 70% of the answer is very correct, in a sense that because now let me tell you the truth. Now most students, when they see what you do first, right, they automatically believe every answer is correct, but they just need to pick what they need to do first. This is common in nursing school to have this kind of thinking process, but it's not common in nursing school for answer to be written 70% correct and 100% correct, leaving you with 30% incorrect statement. A lot of students don't know that, so that is the main reason why when they read their question and they are saying and it's not using any keyword that can indicate there are more than one answer, right? Because right now there's no any keyword that is telling you is more than one answer. The question is just saying the nurse is preparing to administer a unit pack red blood cell to a client. Which of the following actions she did not take? Now, the next thing nursing student is doing is to pay attention to each action right here. So when they pay attention to each action, they want to select the answer. They are in answer mode. So they are in what? Looking for something that look correct to them. Right? Unlike if it is first, they might believe every answers are correct, but they just need to pick something they need to what? Do first. So there's no any keyword like priority, most important, best, right? That's telling you pick um just one answer that is important first or something like that. There's nothing like that here. So we cannot have that same thinking process. That is what I'm telling you. Also, the second way NCLEX writes the answers are to be 70% correct or 100% correct. So leaving you with 30% to be incorrect. So you need to always spot that thing. So now if you are seeing your question don't having those keywords, immediately start thinking about it. That NCLEX is testing you on the other side, which is some answers are written to be 70% correct and just one answer is written to be 100% correct. Also, let me just put this out there, right? A lot of students make this mistake. NCLEX don't tell you to select right answers all the time. Sometimes NCLEX will tell you to select the wrong answer. NCLEX will tell you, look at all these answer keys and look for what is wrong and select it for us. NCLEX can tell you, look at all these answer keys and look for what is right and select it for us. Like now, this particular question is telling us to select what is right. It's not telling us to select what is wrong. Right? But I'm trying to tell you, because a lot of students think it's always positive answer that NCLEX is looking for. No, sometimes NCLEX make you select the negative answer in that answer options. Right. So take note of that. Right. So now, in order to answer NCLEX question, this is why I teach my students. Remember, I said NCLEX have three parts: the body, the stem, and then the answer keys. So you need to pay attention to these three things because they help you break down the question. Now, the first thing I'm going to do is to ask myself, where is the body of the question? Right. So I'm going to say, okay, the body of the question, right? I have that. Now, the body of the question contain the content. Now, this is the body of your question. Now, the reason why I know this is the body of your question, if you are taking NCLEX and NCLEX-RN PN, definitely you'll be able to know the body of your question. The body of your question cannot have this sign right here. It's only the stem that have this sign that is here, right? That is the stem, right? The body of a question, you can easily figure it out, right? But for the Rex PN, this is for Canada, right? You will not see this sign, but you can also still understand your body. Rex PN, like the three exam, the NCLEX RN, NCLEX PN, and the Rex PN are all written by the NCSBN. They are all written by the NCSBN. So the testing format is the same thing, right? It's just the look that is different, right? NCLEX have this to make you identify the stem, right? But REXPN don't have that, right? But let me explain something to you. The body of your question is never going to ask you any question. It's the stem that is going to ask you question. Now read the body. It said the nurse is preparing to administer a unit pack red blood cell to the client. Is that a question? Obviously no. It's just like a statement telling you what is going on. So that is how the body look like, both on the RN, PN, or Rex PN. So that is it. Now the body of your question contain the content. Remember we talk about RN having what, 146 content, and PN having 150 content. So the body of your question contain this content, right? The stem of your question is the examiner question. Read this stem right here. Now I said, which of the following actions should you not take? That is a question, right? It's just like right now I tell you, I have 3 cars. Then you'll be able to say, okay, what else do you want to tell me? Like you like feel like I have something more to say, right? Because how will I just walk up to you and just tell you I have 3 cars? We never planned on having that discussion. So what else do you want to say? I have 3 cars. Because it look incomplete, right? I say, but maybe if I just say, I don't like one of them, or I'm going out, right? Which of the car do you feel like I should take out? And there's a question, right? That is how NCLEX works. So you can identify this both on the NCLEX-RN and PN easily, and you can identify it on the REX PN if you follow that format. The body of your question is just a statement. The stem is the examiner question. So this is the body right here. This is the stem. Now the body, I want to spot the content. Now on the NCLEX exam, NCLEX plan to test students on 2 things, right? NCLEX plan to test students on complication, right? And administration. Administration, let me just put it. Administration and complication related to what? Blood transfusion. So now the administration part. Now NCLEX is about safety. In general, every NCLEX exam question you are going to get is about what? Safety concern. So you are going to ask yourself now, NCLEX is not trying to just test you on how to perform a certain task. NCLEX is trying to test you that on if you perform this certain task. Every question on the NCLEX exam, NCLEX is testing you because if you don't do that thing correctly, it's going to lead to a particular safety concern, right? So now, if you are reading any content, you need to ask yourself, what is that safety concern that if this particular thing can lead to? How do I carry this thing out properly so that I don't cause that safety concern? And when there's that safety concern, how do I react to it? That is how you ask yourself question. That way, you have covered everything NCLEX can likely test you about that specific content. But guess what? I have all this thing in my coaching program. You don't need to do all this process yourself. You just need to join my coaching program, and you get that all sorted out. Now, now we need to administer. We need to think about the complication, right? So now we have various kind of complication, right? Now, due to the kind of complication and how we try to fix those complications, we think about doing vital sign, we think about assessing urine output, we think about asking for history, right, of maybe previous blood transfusion, we think about like setting white tubing, we think about the peripheral venous access device, we think about verifying with another nurse. These are things that we think about, right? We think about monitoring the patient for the first 15 minutes, right? So these are things we tend to what do. And we think about setting up what our normal ceiling. These are things that we think, right? I just gave a lot of information right here. So now let's apply this information to this question. Now if I read this question, I'm seeing access the client urine output. Automatically I feel this answer is correct because yes, we access urine output. Now I'm seeing the NCLEX saying we should prime white tubing administration. Automatically, I think this answer is correct because yes, we prime white tubing. Now, if I see ensure that the client has peripheral venous access device, I'm 100% sure. Yes, we also do that as well too. I'm seeing verify with another nurse. Guess what? Yes, we verify with another nurse. So at this point, I'm lost. Then I'm like, what cannot be the correct answer since everything are correct? Now, remember the rule I said 70, 100%. Now, guess what? NCLEX It's not an area for confusion. It's you that don't understand the NCLEX. Now, guess what? I'm now going to look at this and ask myself, is there anything that is that 30% that make this answer incorrect? Now, let me tell you one problem. A lot of students don't read their answers completely. The moment they just spot, nursing school question is different from NCLEX question. Please, if you are ready to pass the NCLEX exam in 85 question, know this. Nursing school question don't give you problem. Answers don't give you problem. NCLEX answer give you problem. You need to think through the whole statement. You cannot just pick little statement and say, okay, yes, because I've seen this statement, the answer is automatically correct. You need to pay attention to every word, because one word can make every good looking answer incorrect immediately. Right. Assessing the urine output 100% good. White tubing 100% good. Peripheral venous access good. Verify with another nose good. But everything are good. But guess what? NCLEX has planted that 30% statement that's making them incorrect. And just one answer don't have this and make the 100% answer correct. Now, let's pay attention to this question again. Let us spot them out. Because you need to read everything through. So, assess the client urine output. I'm like, is there anything that's making that wrong? Obviously, no. This answer look correct to me. Perfectly. Now, look at this. Prime white tubing blood administration set with lactated ringer. Yes, white tubing blood administration set is correct, but lactated ringer is wrong. We don't use dextrose, right? And we don't use lactated ringer, which is LR. We use normal saline. So that's why it's wrong. So this is the 30% statement that made the answer incorrect. Now, do you see that answers on the NCLEX exam don't look correct? Instead, it's you that don't understand the NCLEX. Am I making you understand something about the NCLEX? There's a lot you can understand about the NCLEX. I'm just giving you just some things. Oh my God. Now, these are things just related to the answer keys. Trust me, this will help you out breaking down your answer keys. In as much you know about this part, trust me, this is going to work well. Right. Now, I want to make sure you go on the NCLEX exam, and then when you see the question, it look like another practice test. I've told you how to identify this. All you just need is to go study what? Your content. And your content is what? On the NCLEX test plan. And that content is what? RN 146 content and PN 150 content. The moment you know this content, you can be able to identify your question. So now I've taught you how to break down your answer key. So once you know the content, you know how to break down the answer key. The only thing that remains is understand how the NCLEX writes the question. That is the reason why I follow this theory process. Content, knowing how the NCLEX writes the question, and trying to understand. Because if you can get this theory part, I've been doing this for the past 2 years. I've helped 700 plus students to pass the exam. It works. It work. Students will tell me, "Oh, I failed the exam. Oh, sir, I've finished nursing school for a long time." It work. They still pass. They still pass. So you are definitely going to pass, right? This is the only part. Now, this part I've broken it down. Remember, I said I analyzed 1,940 questions. And I noticed from this 1,940 question, NCLEX only write their question using 62 formats. So if you can know this 62 format, right, and n- you will start thinking like the NCLEX, right? But this 62 format is generated from just 6 concepts. So the moment you can know this 6 concept and this 62 format, you know the bigger picture of the NCLEX exam you will pass. Now you can dominate the exam because now you now know this. But this is more of a big explanation. You will only be able to find out in my coaching program. Right. So now this part, you already know this is wrong because of this 30% statement. Now, yes, we ensure the client have peripheral venous access, because if they don't have it, where are we going to insert the blood? In the client's mouth? Obviously, no. So, obviously, this is correct at this point, but what is incorrect is right here. 24 gauge. So this is the 30% that make it incorrect, because we only maintain 18 to 20 gauge. This 24 gauge is wrong. That is why this is as well too wrong. Now look at this other one. Yes, we verify with another nurse. This is even the first thing a lot of students used to say. Verify with another nurse. Okay, but do we verify using client room number? Yes, we use the ID band, but do we use room number? Obviously, no. We don't use room. We don't use bed. These are red flag. We only use the patient's name and date of birth alongside with what? The ID band. So am I making sense? So this is the 30% that make the answer incorrect as well too. So that's why this is wrong. So when you are thinking about the question related to nursing school way of thinking, you thought every answer looked correct. I'm telling you, I gave 50 students this question. Most students, they are like, at this point, I'm confused because I don't know which answer I will go for. Okay, I believe number 2 is incorrect because it's saying lactated ringer, and I know we use normal saline. I'm not sure. But this, is it 24 gauge or larger? I'm worried about the larger. But I know we verify with another nurse. Um, Access client urine output. I know about vital sign. I don't know about urine output. Let me go with 4. This is how students think about it. If you are thinking about your question this way, trust me, you are not ready to take the NCLEX exam yet. Because one, there's one thing to know the content, there's one thing to know how the NCLEX will test the content. So I'm not just giving you the content, I'm giving you how the NCLEX test it. Now, this question is trying to test your ability to uh prevent complication before it even happen, because the answer, that is what the answer is testing. Because the answer is one, access the client's recent urine output. Look at the keyword recent urine output. We check for urine output before and after. Now, recent urine output is that we are trying to find out if this patient is passing sufficient what urine, which is between what 30 to 60 ml per hour. Now, one of the complications that occur, remember I told you NCLEX is trying NCLEX test on complication. One of the complications that occur is what we call circulation overload. Now, in order to avoid circulation overload, guess what? The kidney need to be working properly. If the kidney is not working properly, guess what? Then circulation overload will be a problem. You understand what I'm trying to say? That is the reason why before we initiate the blood transfusion, we need to make sure that this patient can pass enough urine, which is what 30 to 60 ml per hour. Not making sense. Okay, right. If I'm making sense, I want you to really appreciate what I'm doing, right? Because it take a lot putting together all this knowledge, right, for free, giving it to you. That's all. So I really want you to appreciate by the only thing I want from you is just to subscribe, right? Subscribe, and trust me, I'm going to reward you for that. Like, you subscribe, I'll keep giving you knowledge that you can start using in order to what pass the NCLEX exam successfully. Like I always used to tell my students, the exam is not difficult. It's difficult to the exam. NCLEX made it possible that it is difficult to fail. When you feel like your exam should stop at 85, they keep giving you more questions because the NCLEX is not giving up on you. They still feel like yes, you can still show them that you are safe now, so they give you more questions. Oh my god. Right. So yeah, this is the NCLEX, right? I've said a lot and I definitely know you've learned a lot as well too. So appreciate me by subscribing, share with friends. Even if you are watching this and you are maybe not taking the NCLEX exam, because most of them will message me and they will say, oh, I'm just watching, I want to just appreciate you because I love what you're doing. I'm not taking the exam, I'll be taking the exam in the next 3 months when I'm done, but I just want to communicate with you so that when I'm ready, you can definitely help me. Yes, even if you are not doing the exam now, right? You can also still share the link with somebody that is doing the exam. Let them learn as well too, right? This help me to know what students are lacking, and then I'm able to what teach this knowledge so that a lot of students can learn. Right. There's little I can teach on YouTube, but there's more you can learn from a structured program, which I've done for you, a coaching program that teach you everything you need to know. And I can guarantee you at the end of 8 weeks, you are definitely going to pass. Now let me introduce my coaching program real quick. Right. It's a 8 weeks coaching program. Right. The first 4 weeks, all we do is content. Right. Second 2 weeks, we do questions. Right. That's your readiness question for 2 weeks. And the last 2 weeks, I'm going to teach you what? Strategy. Right, strategy. Now, once you know the content and you start answering the readiness assessment, I expect you to meet up 60 to 90% passing, right? Pass rate. Then, if you meet up with this, right, I am like 80% feeling you are ready to take the NCLEX exam, but I want to seal it up to be 100%, or let me say 99%, right? That you are able to pass the exam. So, I will give you strategy. So, once you are able to use strategy and content to answer the next readiness assessment and you meet up this, right? 75. I don't want you to be less than this. Most students, when they take the readiness assessment at this point, I've seen students that are 85%. I've seen students that they are like 70%. or more than 75%. But guess what? I don't just want you to drop less than 60. You should be in between. Right. But now with strategy, I expect you not to even drop less than 75 all the way to 95%. Right. So I want to see you touching 91%, 92, if not all 95. Now I believe you are 100% ready to what, or 99% ready to what, pass the exam. Nothing is stopping you from passing the exam. Nothing is stopping you at this point from passing the exam. So this is the unique approach I use in order to help students in passing the exam successfully. And once you go through this journey with me, because you are not doing it alone, you are doing it alongside with me, I'm going to guide you through. When I was preparing for the NCLEX exam, my journey was like this. Right, I started and then it was just like this, like this. I was trying to figure it out myself. I got way, but I ended up passing. But it was a stress because it took me 1 year, because I was not about to take the NCLEX exam and fail. Right. If it's going to take me a long period of time, then fine, so be it. I struggle with knowing fluid and electrolyte. It took me 6 months to understand fluid and electrolyte. Now, maybe God was just walking me through this process so that I can be able to help somebody that is struggling out there to pass the exam. But here we are, right? 2 years, and I've been able to what, help 700 plus nursing students pass the exam. It means a lot to me, right? Two students passed the exam yesterday, and I posted it on my group. I was like, wow, people were like, oh, you have been seeing you helping a lot of people. I want to be part of the um I want to be part of your story as well too. I want to get the same transformation. Yes, this is the transformation I want from I want for everyone, right? So if you are interested in joining my coaching program, it's an 8 week coaching program. The coaching price is $497, right? I also offer payment plan, right? If you are unable to pay this once, then you can pay a down payment of what, $250, and then you all you need to just do is to tell me when you are going to pay the remaining 250. Yes, let's just do this and let's be able to pass the exam. Again, I'm going to state my phone number, right? All you just need to do is to text me +1767 613 0769. Right. Happy studying, nurses.